My name is Jonathan Harrison. I have been at IVC for approximately 3 years. I previously practiced in Las Vegas for 3 years as well. A varicocele is a small little cluster of veins, or varicose veins, that occur in the scrotum. Most varicose veins occur because of reflux or incompetent or inefficient veins, and the same thing is happening in the scrotum. The actual vein that this is happening in is called the spermatic vein. The symptoms of a varicocele are very common amongst patients. First of all, it's all male because it's in this spermatic vein, and the varicose veins are occurring in the scrotum. And the symptoms when you have these is a dull, aching pain that is more severe when you have been standing for much of the day, or when you've been doing a lot of exercise or a lot of work that requires a lot of lifting. Varicoceles affect approximately 10 to 15% of the general population of males. Sometimes a male may have a varicocele and not even know that they have it. They typically present to us because they've been having the symptoms that we've talked about. Varicoceles are diagnosed by clinical symptoms, number one, and number two, with an ultrasound of the scrotum. Varicoceles can affect fertility. We've found that in males who experience infertility issues, about 30 to 40% of them have a varicocele. The mechanism in which this occurs, we think, is secondary to increased temperature that occurs around the scrotum because of these varicose veins. And that increased temperature can inhibit sperm production and make fertility issues more prominent. So there are two ways in which a varicocele can be treated. Traditionally, you can go the surgical route. Surgical route occurs in which you go to surgery and they identify the veins that are incompetent, these spermatic veins, and they actually go in and they clip them surgically so that they don't have any more problems with reflux. The more recent development in treatment is called varicocele embolization, which we specialize in. Varicocele embolization is where we go endovascularly into these veins with little tiny wires and catheters, and we insert a little bit of irritative foam or little titanium coils into the vein and close those veins down, and making it so that reflux does not occur anymore, thereby resolving the varicocele. The advantages of varicocele embolization are many. First of all, when you compare them to the actual surgery that can also be done for this, is the embolization is minimally invasive. Therefore, on the day of your procedure, you're coming in the morning, you're getting the procedure done. It takes about an hour to do it, and then you're leaving about 2 hours later. The other advantage for varicocele embolization is it is more affordable versus surgery. The outcomes between the two, surgery and embolization, are equivalent. You're not getting any difference in outcomes between the two. We have found that it is very effective. First of all, what we're trying to do is, it's twofold. If you're coming in because of pain or discomfort, we have found that over 75% of patients report vastly improved discomfort and pain several months after the procedure. If you're coming in for fertility issues, we have found greatly increased predictors of improved fertility. Those predictors are mainly focused on the semen quality and the sperm count and sperm motility. The actual procedure of embolization is not painful. You do, and it is common to have a little bit of discomfort afterwards for 1 or 2 days in the form of back pain or a little bit of scrotal swelling. The recovery of embolization is very easy. You're able to go to work the next day, and then you are able to manage any mild discomfort with just mild Tylenol or with ibuprofen. The symptomatic relief that a patient will feel from a varicocele embolization will occur within the first few weeks after the procedure is done if they're coming in for pain and discomfort. If they're coming in for fertility issues, it takes about 3 months for the fertility, for the improved sperm production and semen quality to get up to where it should be. The restrictions post-treatment for a varicocele embolization are very minor. We ask that a patient just abstains from physical activity for about 3 days. They're able to go to work the next day, but after that, you can participate in all normal activities.